Hello everyone, today is a special show. You know why? We're in the middle of this cold weather because I decided let's get out of the house and go to my favorite pharmacy. Mostly is CVS, as you can see. I don't work for CVS, it's not a commercial. It's just I wanted to tell you that I love the pharmacy, but also I wanted to show you how do you choose the correct toothbrush and the correct toothpaste. Do you have to wait until you get to a specialist, a periodontist that are in charge of telling you what is the best toothbrush or what is the best toothpaste? What about if you don't have the money or the time to go and see which one you're gonna choose? Do you wanna use a whitening if you're in an emergency for a party? What about if you're clenching your teeth and you don't have time to have an eye guard? Or let's say one of the cavities of their tooth gets broken. We have a special dental kits here in the pharmacy. Let's go together and watch what we found. Okay, now look at all this. A hallway with toothpaste, whitening, to rinse your mouth. I mean, oral rinse that is holistic. I have one given to me. I mean, you get lost in this amazing, it's like a little kid coming here. So when you think about, have now this, it says Parodontax Daily Fluoride Anti-Cavity and Anti-Gingivitis Toothpaste, Optic Gum Repair. This can be a good one. I'm taking it, I have tried it, and it's good. It's not good, it's gonna repair. This is not gonna repair anything. What is gonna help you have some ingredients that may help you. But if you don't have the right technique, it doesn't matter. I am gonna take it, we're gonna try it. I will give you the results. We'll try it again. Now we have Sensodyne. This one, I love it. I love this one because this one, Sensodyne, has a desensitizer. So once I did whitening by myself to try a product here, and I did not follow the rules of what the instructions were, and instead of leaving it 5-10 minutes, I left it like a half an hour, and it messed up my enamel. And I just did it to help a patient to choose what was the best whitening to choose. And guess what? The best whitening is you go to your dentist, they make a nice tray, and you go every single night to do your whitening following the instructions of your dentist. And if you get sensitivity, the dentist, like Dr. Frank Vijak, will give you the sensitizer. So you place the desensitizer sometimes, and you don't do this every day. There's another situation with toothpaste. As long as you see a toothpaste that it says here, it helps preventing the bleeding gums, okay? We have Colgate, but it has the whitening. I am concerned about every toothpaste that has whitening unless I am very sure that the abrasive materials are not gonna start diluting your enamel. I will not recommend it. Now, you can always recheck with your periodontist or with your general dentist. I, as endodontist, I am in a mission since I graduated from dental school, or I was a student, to teach all my patients how to take care of their teeth, because remember, my mission in these different shows is to teach you, to educate you to avoid dental treatments. How do you avoid dental treatments? By taking care of your oral hygiene. And I am in a mission to teach you that. As an endodontist, I would love to see you in my office having a lot of root canals. I always tell my patients, if you wanna give me more work, don't brush and floss at night, and don't wear your night guard. We will talk about night guards in the store in a minute. Also your toothbrush. How do you know the toothbrush? This toothbrush has a nice shape, it's soft, that's one of the biggest requisites. If it's soft, it's good. If it's hard, you don't buy it. If this is extremely big and you think it's not gonna go to your mouth, don't do it. Use one that you're gonna be able to use. Now, again, any Sensodyne toothpaste, Pro Enamel, they usually, look at it, it costs $9.29. And then this one, that is the brand of CVS, who has exactly the same ingredients, it's just made by CVS brand, is $6.49. And they give you 50% off if you buy a second one. Okay, so after that I said sensitivity on the gums, it's not on the gums, it's mostly on the teeth, and you feel it right on the gums when they recede. And this, I told you before, doesn't need to be the most expensive. This is CVS brand, but look at the difference. Sensodyne $9.29, CVS brand $6.29. This is not a crappy toothpaste. This is not, because it's cheaper, because it's CVS doesn't mean that it's not gonna work. It has the same ingredients. It's just the brand name what is more expensive. Why? Because the company that makes Sensodyne has to pay more taxes and more money for the name of the brand, etc. Everything is more expensive for them to produce, therefore they have to charge you more. But what I like of this brand now, they coming up with, Sensodyne came up finally, and I'm very happy to see that, with a soft toothbrush. And it's soft and it's small. You can use it for yourself, sometimes for the kids, depending on the size of their mouth. The bottom line with Sensodyne, I like it for sensitivity. You can choose any one, just be careful with the whitening that is not too abrasive. We jump here because we're going by what we find on the counter.